everyone, my name's Lisa and I'm going to be speaking today about safety planning, and I'm going to be differentiating for me the difference between safety planning and crisis planning. I read a poem that I had written for a presentation I was doing at a Towards Zero Suicide launch here in Northern Ireland, which I posted on Twitter last night, and in that I was talking about how I was really drowning in risk assessments and how it became my diagnosis. Just to give you context for anybody who doesn't know me, I have been a person who really saw a psychiatrist at the age of 14 and I never really got out of the mental health system. So I can say that I do have a lifetime of experience in services. I feel very passionately about safety planning. I'm not going into my whole history, but between 2009 and 2017, I spent many months of every year as an inpatient in our psychiatric inpatient unit. I had a lot of difficulty with self-harm, quite serious self-harm, and had attempted to take my life on a few occasions. Safety planning wasn't on the cards at that time. What I did have on discharge from hospital was, I think it was called can't even remember what it was called, but I've got some of my notes, and basically on that it listed things like signs of risk is non-compliance with medication, protective factors were things like my children identified on there. I'm going to talk you through, I have recently redone my safety plan. I went to treatment in South Africa in 2017 for 6 months, and when I came back from that I was much better, relatively speaking. And however, I'm still in services and I'm finally getting the help that I actually need. And with that, I've started with a new therapist recently and had my diagnosis changed to complex post-traumatic stress disorder. I don't use the word disorder because I don't think I'm disordered. I think what happened to me was disordered, not me. But in terms of that, in terms of starting the new therapy, I did need to put this together. It's a bit strange because I've almost avoided looking at this and looking at a crisis plan, because I think for those of us who have been in and out of crises and have been to that place many times, it's actually quite difficult sitting down and doing something like this. I just want to say that what I'm sharing with you is my truth and my experience. It is a truth, it is not the truth. There are lots of different experiences for people out there, and this is relevant to my context. However, given the work that I do and with the number of people I know and have been in services with, I know I don't just speak for myself. Also, just to be clear that a safety plan is for everybody, although I am focusing on those of us who've been in services for a long time and what I believe is really essential to make a meaningful safety plan and what that looks like. But 70% of people, well, here in Northern Ireland, who go on to complete suicide are actually not known to mental health services. So safety planning is for everybody. And safety planning has simple questions in it around what are the things that help soothe and calm you, help keep you well, what are the things that give you hope and meaning, what are things that you can do to distract yourself, how do you keep yourself safe, how would you keep yourself safe if you weren't, and looking at who your supporters are in your life and emergency contact numbers. However, what I realized when I sat down to do my safety plan is, I know at the moment there's this drive to reduce suicide and focus on self-harm and things. But to me, it's really important that when we're looking at this, that we're not just ticking a box to say, well, yes, 90% of people, say, in our services have completed a safety plan. That's all very good and well, but it's how meaningful that safety plan actually is to an individual, which is actually going to make a difference longer term. Though obviously there needs to be research and evidence around that, but that's certainly my experience. So doing up my own safety plan, I first of all want to say that if you're a professional working with somebody like me who's been in the system a long time and has been in and out of crisis, this was actually quite a difficult piece of work for me to do, to think about. Not in terms of the initial part, but I'll go on to talk about the crisis part. But I'll also have to say that I'm a trainer in the Recovery College in our trust. I consider myself to be very well educated about myself. I have had the time and the input and the support to look at what are the things that keep me well, what do I do for that. I had a lot of support in place to help me get out of that cycle that I was in, of in and out of crises. And yet, even with that, this was not easy to do. So that's point number one, I suppose, is in terms of a safety plan. I think it's really important that however that plan is saved on our system for a professional, that this is a dynamic document and it needs to be able to be updated quickly and easily. I know Northern Ireland Encompass is coming along, and I think it's crucial that before that system is in place, that these kind of things are relevant, both for staff and service users. Staff have so much paperwork to do anyway, that we don't want to be creating more work for them. And as someone using services, I don't want to have to come and redo and rehash things all the time. So that's just one point. This should be a document. If a person is moving along their journey, I don't think a safety plan should be staying the same. So when I started my plan, what was actually, I realized, important to me as somebody who's been in services a long time is if I needed to, I don't have a key worker anymore, so if I needed to contact somebody to get help, what I want to be there on my plan is about my diagnosis of complex post-traumatic stress. I've got it up here. And in that, it's really important for me, I have put down how that diagnosis affects me, how it impacts my life, what are the things that come with that. Because I could, if I needed to phone and get into the crisis team, I would want them to be able to bring up a document and say, okay, so for me, it's really important if I'm in crisis to understand that if I'm phoning you because I'm needing support, I'm wanting to self-harm or whatever, or I'm experiencing flashbacks, what's going on, I would want you to know that it's important if you came to my home that you keep a distance from me until I felt safe with you. That you didn't judge me for sometimes when I'm in that state that I need help, things are going on for me that could be difficult to talk about. I don't want to assume that I'm really crazy when I'm not. And this explanation here gives an explanation of the impact of complex post-traumatic stress in my life, because we've got to remember that everybody's different. I have also then got in my safety plan understanding triggers, which is really useful to put down. Understanding triggers, though, has been a work in progress for me. That has required self-awareness. If I was working with a professional around this, it would be about the professional actually supporting me to have a look at these things, to become aware of these things in between sessions, to keep a note of them. Because it's, as I've moved along, I realize that there are different things that trigger me, and that could lead me to feeling unwell or feeling like I wanted to harm myself. And there are things in there, even like not feeling listened to and heard can be a trigger. Unexpected loud noises, not sleeping, not getting enough sleep. I've got to be very careful about the movies and things that I watch. What I'm trying to share with you is that there's quite a lot of detail that needs to go in there if we're really going to be working with people. I also have a section under signs that I'm struggling and need to take action. This is really important to me because when I'm in that place, and especially as being a person who is considered relatively well, and it might be a bit difficult for people to actually accept that even where I'm at, I don't just not stop thinking about self-harm, and it's not that I don't ever think about suicide either. There's no plan in place around that. But I have a long journey that I'm on, and I've got to be realistic about this and put things in place. So in terms of that, it can be actually difficult for me to reach out and ask for help. And I have put down things here that would indicate to, say, my husband or to someone in services, because I don't have a key worker, about indications. Well, if a lot of these things, like wanting to be on my own, overwhelming feelings of guilt and shame, being constantly impatient with my kids, my thoughts racing all the time, not eating regularly, some of my eating disorder behavior coming back, those things are really important for me to be able to monitor when I perhaps need more support. Then I've also got key things that I need to do that help me stay well. That is another work in progress. When I was really unwell in services and in and out of crisis, I didn't have any of these kind of conversations. I was never at a point where I did very much, which actually did keep me well, and I struggled so much and my depression was so bad that it was difficult to actually motivate myself. Also, because it wasn't really a collaborative piece of work, it was very much a case of me expecting the professionals to fix the situation, the right combination of medication or whatever was going to come along, and I didn't have the insight. I did not consider myself an expert on myself. What I'm trying to say here is there's quite a lot of work. This has been developed in relationship with people who I've been able to speak to. It's been getting to know myself. It's been going on courses. It's been able to have honest conversations with people. What I've also realized is, since starting my therapy about 5 or 6 weeks ago with an EMDR consultant, is that I have needed to add in a lot of things to my safety plan, of things that ground and soothe me, new things that I'm learning. And that's why I spoke about a safety plan. However it's managed in a system, wherever you're working, not just in Northern Ireland, it needs to be user friendly if it's actually going to be a dynamic document that people use. I've also put on things here that I've had to reflect on for myself, which is why, in fact, this was a piece of work that was really useful to do when I was more well, and not just waiting till I had a crisis to do it, but almost as a preventative thing. But looking back, I've also had to see that I find it difficult to admit that I'm struggling and to ask for help. It can be difficult. It can actually be difficult sometimes to do the things that we put on our safety plan that help keep us well, soothe, calm us. Those things can actually be quite difficult to do when we are feeling stressed and our back's up against the wall. And it's important in that then to be able to realistically link that into people who can support us with that. And in terms of, at a time when I didn't have supporters around me and services were my only support, that's why it was so important for this kind of information to be on my safety plan document, so that if a crisis team says on a call with me, they can look at that. And I've put on here, I find this really difficult to do when I'm not so well. This is what you can do to help support me. I don't want too many options and choices. If there are two things, please can you help me take the steps to do X, Y, or Z. It's also important for me to put on my safety plan things that don't help me when I'm not okay. So whoever is supporting me with the safety plan will actually know that those things we need to avoid when I'm feeling really vulnerable. I've put down my strengths and work that I do with people in training. People can find it really difficult to identify their strengths. When I was in services, I did not have conversations about things I used to be good at. I played in an orchestra, I was a competitive swimmer, I was a teacher, I was a lecturer. There were lots of things, but I became a risk assessment. It all became about managing the self-harm and the suicidal behavior. And I think what I'm trying to say, it sounds to me like I'm waffling, but what I'm trying to say in terms of the safety plan, this is a piece of work that can be done to identify what are the things in a person's life, why are they going back into crisis, why are they needing to self-harm, what are the things they are doing that aren't working for them, what are the things that aren't in place that we need to help support people to put in place and to learn about themselves that do actually work for them. What are the things as a professional person can I help support and journey along with this person to help them think about and actually implement and try new things in their life? Because when you're really unwell, if you're experiencing psychosis, severe depression, anxiety, whatever the case may be, it can be really difficult to do these things. What I've also put in here are the things that give me hope and meaning in my life. I think if I had tried to do this 4 years ago, this would have been very challenging to do. I'm very grateful that I've got a long list of things here. But what I have noted in this is that when I've attempted to take my life in the past, I honestly believed that my kids would be better, my family and my kids would be better off without me. I didn't disclose this to anybody, any of the professionals I was working with, because I felt ashamed. I was a mum and it somehow didn't seem okay that I would be thinking that. Yet that's really useful information, because when I go on to my crisis plan, that's something in there. I've had this discussion with my team and I've said, if I'm getting to the point where I'm saying that I believe people would be better off without me, we know that I'm really, really unwell and we need immediate help. I have put part 2 of my safety plan as a crisis plan because I've identified supporters in my safety plan as well, and who will support me with what. Sometimes even for people to figure out who can support with what. It might be practical things, it might be emotional support. You can see how conversation and a relationship with somebody is so important in terms of actually helping somebody develop a meaningful safety plan. Crisis plan is different for me. Crisis plan is really when immediate action needs to take place here and now. And that's when, say, my thoughts are going to, my family would be better off without me. Also, when I'm in a crisis, I actually, from my past, and that's all I can take from, is I would have denied that I was in a crisis, that there was anything wrong with my thinking or my behavior. That's a very clear indication that I'm not okay and I need people to perhaps step in and give more support with that. Also have to say, in terms of what we have in safety plan or a crisis plan, keeping myself safe, the reality is that when I'm very distressed, I don't necessarily want to keep myself safe. I actually use self-harm, and I'm going to do another video about that. I've used self-harm as a way to manage really difficult things going on. So that's why sometimes it would have been seen as I was maybe dishonest around it, because I needed that. It was part of my survival, and I didn't know differently. These are for me to be able to have this conversation. I can have it now with my team because I've gone through a long process of finding my voice, speaking to my psychiatrist, having now a therapist who works very much in partnership with me. But I also got well enough to actually be able to do this. So when we're working with people with where they're at, when they maybe are still quite distressed and just out of a crisis and working on this piece, we really need a lot of patience going on with it. I've also put very clearly in here that things like I've had ECT on a number of occasions. I've had a difficult conversation with my husband about that. In Northern Ireland, we don't have advanced directives, but we are going to see a lawyer about that. I feel very strongly about not getting it again. I'm not putting any judgments out there on it, but I have had a year of my life that I have no memory of. And the thing is, I actually liked ECT because for that moment they gave you an anesthetic, and for that moment everything disappeared. The pain, the heartache, the worry, the hopelessness, the worthlessness, the shame, all those things were taken away. These were not things that I was able to discuss and talk about in my relationship with professionals, and yet they really are relevant. Also, just to say, if you're supporting somebody with a safety plan, I had this conversation, my husband's here filming me. We had this conversation around my safety plan, and I was in a really bad way for a number of years, and it was actually quite difficult having this conversation about what if I did become really unwell? What if I did need more intensive help? What if I did need to go into an inpatient unit? What would that look like? And it brought up a lot of difficult emotions and feelings, and we have a very open, good relationship where we communicate very easily, and yet that was difficult for him to think about that time, all those years when I was so unwell. And it was difficult for me as well, in terms of feeling that even having to have this discussion was maybe somehow letting him down, that I needed this plan in place. Realistically speaking, I have so many risk factors in terms of what you look at, the evidence around suicide. It would be naive of me not to put this in place. And none of us are exempt. As I said before, safety planning is for everybody. Just to finish off, I suppose, this was also done in collaboration with my psychiatrist, and it was done with my therapist. It is being updated. The important message here is, and I don't know if I've even got this across, to be honest, the important message is that how we are with people and the relationship between a professional and a person with lived experience, looking at this, not seeing it as just managing risk, but in fact, how do we help the person move towards a place where they don't feel the need to engage in risk behavior in order to manage their life. So it's not just about that, it's actually looking forward. How are we going to help people move out? What is not happening that people are constantly going back into crisis, needing to self-harm, etc., etc. So really this for me is a very big piece of work. We can tick a box that 90% of people have completed a safety plan. I hope I've given you some snapshot into how, in fact, intensive and in-depth and important this piece of work is in terms of actually helping people like me who were very much caught up in a system, in a cycle, downward cycle it was at that time. If we go and help them move out of it, this is a really, really important piece of work and much bigger piece of work. So I'm going to be doing another video on my experience around self-harm and my experience in the emergency department, and talking a little bit about attitudes and stigma and causes around that. So perhaps if you're interested, you'd like to check in with me with that. Thank you.